The title of I am P.F. Anderson. I'm the Emerging Technologies Informationist for the Health Sciences here at the University of Michigan. And the title of our talk today, which I co-authored with Tyler James and Logan Roberts, is on Michelangelo and Reaching for Significance, developing a highly sensitive search strategy for deaf and hard of hearing topics. I am pasting the link to the slides in chat, and hopefully Andy or somebody can share that with the audience because there is alt text and all those nice things to make it more accessible for people if that's helpful. I'll also be going kind of fast because I know we're short on time. So the idea of Michelangelo as a metaphor for what we're doing dates back to a quotation that is often attributed to him about how what he needed to discover the David in the marble for the sculpture was already there. All he had to do was take away what didn't matter. I do a lot of work in systematic reviews, and a lot of what we're doing is trying to take the breadth of the medical literature and take away what doesn't matter and get to the parts that we need so we can then extract the data from that. What most people don't know is that the original marble that Michelangelo was working with was full of problems, and that other sculptors had tried to work with it and decided it was unusable. And it took, I think, 20 or 40 years of people trying to work with it and saying, I can't work with this, before they got to Michelangelo. Even after Michelangelo did the sculpture, they found all kinds of flaws and problems that were present in the marble. We see that a lot in the medical literature, where you talk about publication bias, and I'll get to that more in just a minute. But there's the problems there. And I was thinking about how in doing systematic reviews, if you think of taking away what doesn't matter, in a sense, what we have to do first is we have to actually create our marble block, because we're not dealing with the whole mountain of marble that is the medical literature. We have to carve out a chunk first. And in carving those chunks, there are different methods. And this is where the metaphor of the marble block is even more appropriate, because there are methods that make the marble more fragile or more breakable or more usable, and that there's different approaches that are appropriate for different points in the process or different types of questions. So HSSS in this context is standing for a highly sensitive search strategy. And I'm going to talk through a little bit about how we did this here. They are designed to be very sensitive rather than specific. We don't want to give up the specificity entirely, though. We don't want people to be weeding through 6,000 citations looking for something about dental caries and discover that 4,000 of them are about blood cancer, for an example. So you want to balance that sensitivity and specificity, and there are different highly sensitive search strategies that have been developed for different common research questions. Publication bias, I mentioned, is one of the main reasons why these are valuable. That there's also cataloging bias, which I don't have in the slide specifically, but when you go to Medline and search, for example, you may search for randomized controlled clinical trials, and do the official cataloging term for that and come back and find things included that are not RCTs. And you go, how did that happen? Well, the person cataloging doesn't have the level of expertise as the medical experts. They are a librarian, and they are searching for clues to randomization, but that doesn't always mean it's an RCT. So you find that you find biases in what's published and what's not published. You find people deciding to withhold their data or publication because they didn't like the way the results came out, or they didn't think it was publishable or interesting enough. And these all lead to problems with bias in the literature. So there's just a lot of different reasons why it's important to work to minimize that amount of bias. The other thing of making a highly sensitive search strategy is that it gives you a larger data set. It's not a really massive data set, but it is larger than what you can usually get without it. That's not always true, and there's pros and cons for working with large data sets that often apply to this work as well. So you want to keep that in mind. It's not always appropriate for the question. Now, in searching for disability literature, it's often a very narrow field. It's often it's often ill-defined, where the topic isn't always clear in the literature, or you'll find it cataloged with another topic and the disability aspect of it will be ignored or not assigned as a topic heading. There's just a lot of reasons why it's very hard to do a literature search to find disability literature when you're looking at it in a broad context. So how do we do this? The first step is to have a really good question. We've been doing a whole series of these highly sensitive search strategies for different disability topics. This time we were looking at the deaf and hard of hearing as the key concept. Once you have a really good question, we drill down from the question in an iterative process as part of building the search strategy. And this is what takes a lot of time and a lot of work and a lot of conversations with the research team and involving a variety of perspectives. So this is the framework that we used for beginning the process, the Fryer form, and there are links to that here. And then how we build out from the frame of the question is through this memorable approach, where you divide the question into key concepts, and then you iteratively throughout each of the concepts build out a pool of terms that relate to a particular concept group. You test that, and then you do that again for the next concept group, and it's a repetitive, iterative process. I'm going to give just a couple very short examples about how we started this. This is from working with our key question. We broke out the two main concept groups, and then we divided the deaf and hard of hearing into another 6 sub-concept groups. And then we broke out each of those into more specific terms and concept groups as we worked through each of the concepts. And we would then, with this slide, I wanted to point out that sometimes we broke out a concept group, and when we tested it, we found it did not contribute to clarifying the literature base that we were building. And so here you will see that under disability, culture, community, and communication, we searched for gestural languages, and we found that there are hundreds of them around the world, and very few of them are actually mentioned in the medical literature. So we ended up not doing that richer, more complex part of the search because it just wasn't in the databases. This is an example from doing a simple search in PubMed, kind of mimicking the approach that you might expect an untrained searcher to use, where you go in and you just search ear infection or otitis media and you get a few things. If you're more expert, you would combine them and put a few together, and you would see that the combined level, if you searched it as just keywords, as text terms, which is on the right side of the slide, you get a different number than if you search it as the MCHES medical subject headings approach, and that gives you some that you would not have found otherwise, that using different approaches adds additional language. And that if you search by the terms, you'll notice that there's 14,000 that you would never find by searching as the medical subject headings. You're getting, even though they're the same terms and they are mapped to the same headings, you're getting different things. And this is part of why we do some of these different approaches. This is taking that, again, a simple minor concept, and an example in Ovid Medline where it was built out richly. And this is showing how those numbers differ also, but you see that we get very different things than we were getting with a very simple approach. So what do those numbers mean? Sometimes when we take this approach, I want you to understand that we did that approach that I showed for ear infection, and we did that for all disorders that relate to hearing and all of those other sub-concepts that we broke out. So we were doing this iteratively for many, many topics over a period of months to build out a really comprehensive search strategy. And you don't know if what you find will be significantly different or helpful until after you've already done it. And what the numbers don't tell you is if the articles are actually on topic, or if there's patterns like the gestural languages that aren't helpful, or like the dental caries and blood cancer confusion, topics that could be excluded. So working through that. You have to validate it to show whether or not what you're doing is actually helpful. And the validation is as iterative as the process, where you validate each of the small portions as you build them. Then when you combine them into a concept group, you validate the concept group section, and then eventually you are able to combine all of them into a complete search strategy for the question, which you can then test against sentinel articles which were selected for the purpose of validation, to show whether the search strategy is actually doing what it's supposed to or not. So what else did the search process do for the research team? We designed a work process that allowed us to work collaboratively in the same Zoom space at the same time on different portions of the project. And that proved very productive, because when we had done it other ways, using email to communicate, it was a lot of back and forth and it wasn't as time efficient for the team. These are quotes from a debrief session with the research team where they expressed having more confidence in what they were finding as part of having done this highly sensitive search strategy and more of this approach. The other members of the team are in the audience, and when we do the Q&A, if there's questions about that process, it would be great to include them as part of answering questions if they relate to the process. And the image credits, and on to questions. Thank you very much.